like a majority of people in my family are not doctors, or they're not even in medicine, and so it's helpful to have that perspective. There's people who live entire lives right outside of medicine. This is a little side note, but it's really important also to think about what you want your life to be like as an attending. I think going through medical school and becoming a doctor requires a lot of forethought and just thinking about what the future will be like, which is hard to do when you're in high school, right? But each step is very important, and you just have to continually think about what you want in your future, and be very proactive in making changes that will help you in the future. Okay, so neurology. This is what you guys are here to talk about, to learn about. Okay, so I had many different things that I was interested in. Going into medical school, I was really interested in orthopedic surgery, and I prepared myself to do orthopedic surgery. All my research was in orthopedic surgery. And then I did orthopedic surgery, and I realized I didn't like it. So that happens all the time in medicine, like all the time. And so you just have to adapt as you go through medical school and kind of are exposed to so many different specialties. So I said before, I took 2 years as two gap years, and I did clinical research at Frugal Clinic in their neurologic institute. So that's where my interest began. I think neurology is really cool because we don't know a lot about the brain, and it's also really cool because if a patient presents with certain symptoms, you can localize exactly where in the brain that symptom is coming from, and then you can ideally treat that person appropriately. Not only was I interested in the topic, but it also gives you flexibility in your future lifestyle. So again, thinking forward as to what I wanted my life to be like, it's important for you to know if you want to be an inpatient or outpatient provider, if you want to be someone who's always on call running to the hospital, or if you want someone who, you want a life where you're not on call at all. And neurology kind of allows both, or many different lifestyles. So like orthopedic surgery, for example, there's a lot of call in orthopedic surgery, so you would have to be taking that into account. Do you want to be at home with your family? I know you guys are in high school, so it's like was far from 10 years down the line or something. But you have to think, like, do you want to be hanging out with your friends, maybe, or your family, and then all of a sudden you get a call, you have to run to the hospital. Sounds cool now, but in 10 years it's not going to be great to have to do. So you just have to weigh what your pros and cons and what your priorities are. That's what I did, and that's ultimately I chose neurology. Okay, so what am I doing as a resident? Residency is a really rough time period. You work a lot of hours, and to give you guys perspective, the normal person works about 40 hours a week, like normal job, 40 hours a week. So we do almost double that. My average hours worked a week is like 65 to 70 hours a week, and sometimes more, sometimes less. There is a cap from the ACGME, or the overarching organization that basically oversees residencies, and 80 hours is the limit. But that's 80, yeah. But that's 80 hours over a 4-week period. So I have friends who, it's possible that I work 100 hours 1 week, and then the next week I work 60 hours. Technically I didn't break any rules, because that's still 80 hours, right, average. So this means a lot of times you are living in the hospital. It is a lot of work, it's a lot of hours. But it's all so that you can be a better physician in the future. Do I agree with it? No, not at all. And there's unions that have been happening in residency now across the country that have been helping to decrease this amount of workload so that you're not always in the hospital for so long.
And this is more for residency?
For residents.
Okay.
To be clear, residency. It's not like this with attending at all. So.
How many years do you have to be a resident, to be a doctor?
So, after medical school, you have that MD title, but in order to become an attending, it's 3 to 7 years depending on your specialty. So 7 years is neurosurgery. So those are a lot of the colleagues that I work with are in neurosurgery. I don't know, that's insane to me. I can't even imagine doing and they work way more than this. The other thing,